keynote presentation by the Heat Ready Phoenix team. So Phoenix is the hottest city in the US, and what they're doing is really innovative, cutting edge, and we can learn so much from them here in New Mexico. So with that, I will turn it over to Michelle Litwin to give the presentation. Great, and we see your slides, Michelle.
Wonderful, thank you, Nate. Thank you, everyone. Wow, how do I follow all of those great presenters that we've already had? I just want to say thank you for having us. It really is an honor to be a part of this Extreme Heat Health Resiliency Summit. There's been so many good presenters and such great information, so thank you again for having us. I'm joined today by 3 colleagues. I have Rachel Milne, the Director of the Office of Homeless Solutions with me, Daniel Cheatham, Fire Chief, and Commander Brian Lee with the Office of Emergency Management. Oops. Our work, so everyone knows, is guided by the 2025 Heat Response Plan, which provides a coordinated approach to tackling extreme heat. The plan includes 8 key strategies, which you can see here. We are first responders, public cool space, public drinking water, cool and safe homes, cool and safe mobility and recreation, heat safety for workers, community engagement and outreach, and collaboration across departments. As you can see on the slide, heat response takes a village. Our efforts wouldn't be possible without our community partners who play essential roles in running cooling centers, distributing water, providing outreach, and coordinating emergency services. It's this network of partnerships that really makes our approach effective. Continuing on that theme, we have a lot of city departments, as you can see here on this slide, from public health, emergency management, housing, fire, parks, transportation. It really is a cross-departmental collaborative opportunity, and it takes every single city department and multiple staff to make this happen. I'd like to take a quick moment to review some of the weather that we saw last year. In 2024, temperatures consistently exceeded historical averages, with 113 consecutive days at or above 100 degrees Fahrenheit, 70 days at above 110 degrees Fahrenheit, which unfortunately did set a new record, and 110 degrees Fahrenheit in October, which is, I think, the first time that we've seen that happen. These figures really highlight the severity of what we're dealing with and why we've had to extend our heat season. So on this slide, we're looking at the Maricopa County Department of Public Health data. I'm not going to dive into it too much because this is their data. But as we can see here, we have 602 confirmed heat-related deaths for 2024, within 8 additional still under investigation. While these numbers are devastating, it is important to note that in 2024, we saw our first decrease in heat-related deaths since 2014. That's down from 645 in 2023. We're hoping that this suggests that our efforts are having a positive impact. Here we've got the heat-related deaths by place of injury. So we're looking at the majority of our deaths taking place outdoors in areas without shade or access to cooling. A significant number of those also happen indoors, particularly in homes without air conditioning. And this really just highlights the need for intervention in both public and private spaces. This slide breaks down the living situation of those who died from heat-related causes in 2024. The data reveals 3 categories: unknown living situations, people experiencing homelessness, and people not experiencing homelessness. Oops. While a significant portion of these deaths occurred among people experiencing homelessness, we also saw fatalities among those in housing that lacked cooling, which I sort of mentioned on the last slide. Again, underscoring that heat risk affects a wide range of people. Substance use is a huge factor in what we're dealing with. So over half of the heat-related deaths, substance was a factor. Alcohol and drugs impair the body's ability to regulate temperatures, complicating its response to heat stress. This emphasizes the importance of integrating substance use support into our heat response strategies. I'm now going to pass it over to Chief Daniel Cheatham. He's going to discuss the fire department's efforts, including cold water immersion treatment and some other fun boots on the ground initiatives.
Thank you, Michelle. As our city council and mayor rolled this out, they asked, what can the fire department do as far as initial treatments. And this really, as you see, boots on the ground initiative. Our captains in our EMS section worked with our medical director to really devise an intervention that can help these patients experiencing heat-related emergencies. So, and because we were inundated in 2023. So what the criteria is for this treatment is someone has to be obviously experiencing extreme heat illness. They need to be unresponsive. Their temperature is above 104.5 degrees. And so what we do is we utilize this cold water immersion therapy, cold IVs. We put them in. If you can see that picture on the bottom, it's kind of like a zip up carry-all with cold water and ice. And we're really aiming to lower their core temperature to 101 degrees and initiate rapid transport. In 2024, we had 311 patients treated with this therapy. As you can see, in June, we had 66. July, one of our hottest months, 151 patients received this. And then in August, 70. And we immediately are seeing the evidence from this program in 2023, where we maybe would have seen some patients die from the extreme exposure. Now we're seeing people leave the hospital without any deficits. We're also trying to share, just like we are today, with our local and national partners because we've seen the success of this. We've been contacted by LA County, Miami-Dade, San Antonio. So this is really growing legs and being impactful. What we really did notice as well is that because of this treatment, our heat emergency calls were reduced by 20%. And so them receiving this really has decreased deaths and things like that. Thank you for the next slide. Our 911 calls in emergencies have decreased from 2023 by 20%. So just shows the effectiveness of this treatment plan. 25% reduction in calls within a mile of our heat relief locations. So we have these heat relief locations strategically located throughout the city. And with our interventions, we've been able to reduce from 248 calls for service in 2023 to 185. So that's at 25%. And then for the first time in a decade, we had a decline in heat-related deaths. So in 2023, there was 645. In 2024, 602. So really seeing the effectiveness of this collaborative effort from all the departments. As Michelle mentioned, it does take a village, and this is the fire department's interactions and the results that we're seeing. Now that we've discussed critical medical interventions, I'll turn it over to Rachel Malign. She's the director of the Office of Homeless Solutions, and she'll highlight the expanded services we offer through our heat relief network.
Thank you, Chief. So I just wanted to back it up a little bit. So as Michelle shared, in 2023, we saw just devastating numbers of heat-related deaths, the highest ever recorded at 645 heat-related deaths. And so we made major changes last summer in 2024, data-driven changes. And some of those include really focusing on people experiencing homelessness. As Michelle explained, knowing that they are more susceptible given their unsheltered status a lot of the time. We made the number one change we made was really incorporating homeless services in our sites and also utilizing fire department data, as Chief Cheatham just explained, as well as homeless service data to really make sure that we were offering our heat-related services in the places where they were most needed. So what we did as a city and as a community was layer our fire department calls from 2023 on top of our encampment data from 2023 to find where we most needed to have heat respite facilities. Every year, every single one of our libraries, our senior centers, our community centers are either hydration stations or cooling centers. But given the data that we had from 2023, we made some pretty huge investments. we opened our first ever 24-hour overnight heat respite site, and it was staffed by homeless service providers. So it was right where the data said it needed to be, right in the heart of downtown Phoenix, where we not only had the most heat-related fire department calls, but also where we have a lot of people experiencing homelessness in the city. So we utilized our largest library building. It's a, I don't know, 7-story building. It's beautiful if you've seen it in downtown Phoenix. But it had a space in it that was underutilized. It used to be a cafe before the pandemic. It had just been sitting vacant right there on the first floor, right along light rail in downtown Phoenix. So we quickly converted that space into our 24-hour respite. We had City of Phoenix Office of Homeless Solutions staffing that site Monday through Friday. And then we also contracted out to a behavioral health provider called Community Bridges, Inc., who provided much needed navigation services through at this site and some of the other sites I'm going to tell you about. And that was really, really important. Our heat respite sites were mainly for people to get water and air conditioning and sit and rest. But having CBI and their navigation services allowed us additional resources for people who were interested in more than just heat respite. So we had transportation available, and we had lined up resources for people who might want a bed to sleep in at a shelter, or resources such as detox or treatment programs. And in some cases, we actually housed people right from heat respite sites directly into housing. They had a voucher, they just needed that heat respite and some assistance with navigation. So we really felt that site specifically, it was our most utilized site. It was tremendously successful. One of the other sites that we opened last year in an area that the data showed that we had a tremendous amount of need was a senior center in South Phoenix. So every day, Monday through Friday, that senior center operated as a senior center, and then 7 days a week, it converted into an overnight heat respite. So at 6 p.m. every night over the summer from May 1st to September 30th, it opened as an overnight heat respite service, and then closed again in the morning so it could be converted back to a senior center. And actually, Michelle, if you could go to the next slide, because I want to talk a little bit. In addition to those two sites, those two overnight sites, we determined that the other big areas of need were along our main transportation corridor, the I-17 freeway, which leads sort of out of Phoenix up to Flagstaff. There were 3 hot spots or hot areas that we knew we needed to make sure we had services. So we kept 3 of our libraries, which typically would close at 5 p.m. every night, right? Sort of at the hottest part of the day, they would close. And again, they've always been heat relief areas, but we made a decision to keep a portion of those libraries open until 10 p.m. 7 days a week. Our libraries in Phoenix are also not open on Sundays, but last year over the summer, from Saturdays and Sundays from noon to 10 p.m. they were open. So this was also tremendously successful and really leads into the data that Chief Cheatham just talked about, our reduction in heat-related, our overall reduction in service calls of 20%. And we think all of these sites really affected and were a part of why we saw the first dip in heat-related deaths in the last decade as well. In all of those 5 extended hour sites, we had 28,000 visits. So those are duplicated. We had a lot of the same people, but 6,000 unduplicated people at those 5 sites, the 3 libraries that stayed open and the 2 overnight sites. So we thought that was pretty tremendous. But from my perspective as the Office of Homeless Services Director, even better was the number of people that we connected to additional services as well. We connected over 900 people to shelter, housing, reunification with family, treatment programs. So that was an added bonus to our investment last year. But we learned a lot last year too. It was the first time we had ever done this intensive services where we kept things open longer, kept things open 24 hours or overnight. So we're honing what we learned last year and I'm making some pretty big adjustments. Getting ready to start May 1st, a week from Thursday. Unbelievable. We've already had our first 100-day degree day here in Phoenix. Today it's only 91, thank goodness. But let me tell you a little bit about what's happening in 2025 on the next slide. Oh, no, just kidding. I have one more 2024. We, at the 24-hour site, we had a lot of partners come to that site. We had ASU nursing students come once a week. They did some wound care. They did some intake. They got a lot of service hours, and they helped the folks who were staying at our 24-hour site. We had a Teros mobile healthcare team. They're a behavioral healthcare provider here in Phoenix. They came to our sites as well. In all, we distributed 7,000 naloxone kits, and our Office of Public Health data shows that we have approximately 20% decrease in suspected overdoses over the summer months as well. Public health was a huge part of our heat relief efforts last year as well. And so now on to 2025. Thank you, Michelle. We are going to continue our, Michelle's team does water distribution, not only to our extended hour sites, but to every single site within the city of Phoenix. She provides water to 62 different city community centers, senior centers, and other cooling or hydration centers all over the city. Her team provides community grants to other nonprofit organizations that are out doing outreach, providing water or heat relief kits to people in unsheltered situations, or to people who are just in need of those services. Last year as well, we hosted the women's NBA All-Star and Championship game. And so Michelle provided support for all of that. Right in the middle of summer, we're having all of these tourists come to Phoenix. It's not exactly ideal, but Michelle and her team, as well as the Office of Emergency Management, really provided excellent services. Next slide, Michelle. So this year, after looking at the data that we had from 2024, we realized a few things. We still needed to have services in the same sort of locations, downtown Phoenix, and moving up along our I-17 corridor. But we really felt that the capacity at some of our sites was not sufficient. So we looked to rent a building this year. So just south of downtown, beginning next week, we will be offering our 24-hour services, not in the library downtown, but in a rented site in what is called the Warehouse District in Phoenix. It is a huge, most recently used as a charter school in downtown Phoenix, very industrial. It's also within walking distance from our main, what is called the Key Campus, or our main homeless services campus here in Phoenix. So walkable. We know that 90% of the people who came to our sites last year were on foot or on bicycle. So we wanted to make sure that we were close to those corridors. So very accessible. It's also right along our light rail. And this site has the capacity to take to replace both the library site that I mentioned and the senior center that converted into respite every night, because it's sort of right in the middle of both of those sites. So it has the additional capacity and will take over for both of those sites. And then the other big change that we made from last year is, I mentioned the 3 libraries that stayed open till 10 p.m. 7 days a week. Those spaces were really only for heat respite. So we opened the lobby area space, and people could come in and sit down and get a glass of water and talk with a navigator. This year, we've made a decision just to open the entire library until 10 p.m. We had people in the community who saw that the lights were on in the library and wanted to access those services last year, and they weren't able to because it was only used as heat respite. This year, the entire libraries at those 3 libraries will be open 7 days a week till 10 p.m. Community members can come and get out of the heat and access library services. And then people who need additional resources can continue to meet with our behavioral health teams at Community Bridges, Inc. or CBI and get connected to those resources. So we're super happy to begin that operation again next Thursday, May 1st. And now I'll turn it over to Commander Brian Lee.
Okay, thank you, Rachel. Good morning, everybody. As Rachel mentioned, all of the things leading up to last year were basically data-driven. And part of that was a comprehensive understanding of what the needs were going to be as we prepared for the 2024 summer season. One of the things that came out of this, one of the key insights that we identified, was the need for a comprehensive staffing model. And as Rachel mentioned, I won't belabor, the use of behavioral health, medical, and security components were all essential to this. Although we did have a tiered security protocol that was put in place, we've actually ramped that up even more substantially for this year. And we'll have that security element in place starting much earlier. And we've actually added an additional combination of both private and off-duty Phoenix Police security for this site location. We also identified, again, using our data and the intelligence. Everything we do here in the city of Phoenix is intelligence driven, and it helps us to make those determinations about where to deploy those scarce and resources that we have available. We want to make sure we get the biggest bang for the buck, and we were able to again properly align the resources with the geographic areas based on the data. And we also recognize too that pedestrians accounted for a significantly high percentage of all those site visits that we experienced last year. Next slide. So again, for coordination and reporting, another key takeaway for us is that with the extended hour location that was going to be led by our Heat Ready Unified Command Team, one of the big takeaways that we had for last year was that we realized we had multiple city departments and upwards of a dozen or so different city departments that were involved in this effort. And in addition to that, we also had multiple external or third-party private stakeholders that were working with us as well. One of the things that the Office of Emergency Management was adept at being able to do is work within those complex types of environments where we have multiple agencies. Here in Phoenix, we use the incident command system. For those of you that might be familiar either with the emergency management world or utilizing or working within an incident management team, the city of Phoenix has a very robust program that we use. And for this particular deployment, given that it was a 5-month-long program, we actually stood up a city-led incident management team coordinated by all the individual department directors for all of the affected departments that had a participating role. There are a lot of advantages to this. It certainly gives us the ability to provide just an overall comprehensive planning structure. It allows us to coordinate very complex programs across multiple departments. And really, all we were doing was just providing a clear definition of roles and responsibilities, creating a roadmap for the entire team to work within so that everybody knew what their job was. Everybody knew who to reach out to if they needed something, and it really helped us to be able to put together a roadmap, so to speak, to help drive the program throughout this extended, long-drawn summer. The other piece that was critical for us was establishing a very robust information and intelligence sharing system. And we did that, again, by creating an internal intelligence collection model that allowed us to collect the data that Rachel was speaking about in terms of utilizing the fire department's calls for service. We also utilized case management CARES data that Rachel and her team already had in place. And then we were able to aggregate all of that data into one location so that we had a situation unit leader who was a data analyst that was able to put together those weekly reports. And what this allowed us to do is, as the summer progressed on, we were able to make those just-in-time, on-the-fly adjustments and be very nimble and very adaptive throughout the summer and adjust those resources to where they were needed most to ensure maximum efficiency. Next slide. Again, for those of you that are familiar with FEMA and the incident management team, the beloved planning P that is near and dear to all of our hearts. This was the model that we used, and we actually used this model as we were providing the just-in-time training for our city department personnel as well. One thing that made this model unique for us was that it was one of the first times since pre-COVID that we actually staffed the entire organizational chart was staffed with non-public safety personnel, with the exception of fire supporting some logistics. Typically, we have PD and fire that will fill all of those roles here in the city of Phoenix. But this provided us an opportunity to bring in department heads to fill those critical roles, which expanded our capacity as a city. It enhanced our personnel's ability to be able to function within this system. And it made us much better situated going into this summer to be able to deploy this model once again. Again, our operational period begins May 1st. It's expected to go through September 30th, even though we had 110 degrees still in October. So that extended 2 weeks last year. So we'll kind of take it as it comes. This particular operational cycle, normally in the IMT world, we deal in 24-hour operational periods. However, because this was an extended or protracted event, we actually ran weekly incident cycles. But we did conduct we stayed true to the planning cycle, and we utilized our daily meeting cadence so that we had all of the FEMA compliant needs that were met to make sure that this system worked well. And we also stayed true to the FEMA system as well. And then again, at the end, we did an after action report that was an amalgamation from several different participating directors that provided information so that we could really capture all of those data and the metrics that were important to us. This is just a snapshot in time. It's continued to evolve, and as we get closer to our go live date next week. But this is what our organizational chart tends to look like as we get closer, representing all of the different branches and the work groups and broken out by function. Again, for us here, everything is based on position and function, not necessarily title or anything like that. So next slide. So again, I mentioned the importance of the weekly reporting and the intelligence collection. So off to the right is just a snapshot of one of the pages that really captures the essence. It's kind of a one-pager report that we had our folks put together just to capture some of the data that was of importance, not only to us internally for operational decision making, but also that was important to our city leadership and to be able to share with our county and our state partners as well. And some of the things we were tracking was that hourly visitation data for each of the sites. It helped us to make adjustments as needed. And as Rachel mentioned earlier, the mode of travel and the requested services, in order for us to provide what was needed most, we had to collect that data. And that's where we were able to determine that most of our folks were arriving either on foot or bicycle or utilizing public transportation. We also tracked all the heat-related 911 calls. As was shown earlier, the patient location and the living situations that they were in at the time of the call. And then again, this was used for distribution to our city council, city management. It was also published on our public-facing web portal as well. Next slide. And that concludes our presentation at this time. Again, on behalf of the team, I just want to thank everybody for allowing us the opportunity to present for you today. And we're certainly happy to be here, and we'd be happy to take any questions that you might have.
Amazing. Thank you so much. That was an incredible presentation. What you all are doing is so inspiring. There's been quite a bit of conversation in the chat, mainly people just talking about how awesome and hoping we can do the same things here. One theme of questions is coming up around funding for all these efforts. I mean, clearly you're doing so much. How are you getting funding for it all? How are you advocating for this funding?
I'll take this, and then maybe I'll shoot it over to Michelle too, to talk about some of the specific funding that her team gets. But we have been lucky the last 2 years to have ARPA funding specifically for this effort. Not only City of Phoenix ARPA funding, but Maricopa County Department of Public Health contributed. So last year, the 5 sites that we opened up, what we called our extended hour sites, so the 24-hour site, the overnight site, and the 3 extended hour library sites in total cost the city $3.8 million. About $1 million of it came from Maricopa County Department of Public Health, and $2 million came from the city's general fund or our city ARPA funds. This year, given our enhancements, our budget is about it's about $1 million more, so $4.8 million. Again, we've got support from Maricopa County Department of Public Health, City of Phoenix, ARPA. This year, we are utilizing our opioid settlement funds for some of the behavioral health work that is going into the sites. But this year and next year are really the last 2 years we can count on those ARPA funds, because if you're familiar, those all have to be spent by next June. So we are concerned about that. So we have requested additional general funds to get us through. And then I'll let Michelle talk a little bit about the funding that she gets from other sources as well.
Yeah, thank you, Rachel. So we in the Office of Heat Response and Mitigation were also utilizing the ARPA funds for the last 2 to 3 years. And as Rachel alluded, those are going away. We do apply for a lot of small grants here in the city of Phoenix. The Gila River Indian Community Organization has some really lovely boots on the ground initiatives that they like to support. So 2 years ago, we were able to secure a 3-year grant with them. It's around $65,000 a year. It's enough to get us through, and we're very grateful for all of their support and funding. Every dollar counts. So what we're able to do with that funding is procure heat relief supplies like cooling towels, water bottles, hats, sunscreen, shoes, and we provide that to the Office of Homeless Solutions caseworkers. So as they're out doing their outreach and connecting with people, this might provide an additional layer of resource or something like you need to cool off right now, you need a water bottle, they'll have that resource on hand. We are very fortunate. This is the first year that we are going to have general funds in our office to support this initiative. So the city council and mayor and leadership has decided that heat is important, and we are continuing to hear this at our budget hearings that are occurring right now. People are saying, hey, we want money for heat. We want more support for our Office of Heat Response and Mitigation and Office of Homeless Solutions. So with that sort of guidance, city council has said, all right, we're going to provide a little bit of funding here. So we're going to do $250,000 to continue our lack of ARPA funding since that's gone. So that will go to community groups. And then $330,000 will support our heat relief initiative. So that's to buy water and all of those cooling towels to make sure that we have water and cooling towels and heat relief supplies at all library branches because they act as cooling centers, and then our extended hour and our 24/7 site. So those are a lot of the funding sources that we're working on. And just to I might belabor this, the way we were able to ask for that funding from city leadership was through data. We used everything we learned last year, and we really were like, this is how important this is. This is our first year that we're seeing those decreases in death. So let's continue this. So good work that we're doing. And they were able to find some funding for us.
And thanks, Michelle. I'm just going to add one more thing. There is a big push from our elected officials, not only at the local level, but at the statewide level as well, to get federal funding for these efforts, to treat heat as a natural disaster and to get federal support after these ARPA funds expire.
Great. And can you talk a little bit more about how you were able to collect the data? Was it through partnerships with universities, or was it something that you just did on your own?
I'm gonna let Commander Lee take that.
So yeah, thank you for the question. So again, we rely on multiple sources to again aggregate this data. So really first and foremost for us was taking the calls for service, because that's really where, from the public safety side of the house, where we were really seeing the first signs of impact were based on the calls for service. So the fire department was able to forward that data to our analyst, and she was able to collect that. And then again, working with Rachel and her team through Homeless Solutions, we were able to work with their case managers to get an idea what kind of data they were collecting. And then we were able to take all of that information and overlay that with our city map to show our hotspots. And really what that did for us is to validate that, number one, we were collecting the right data, and that number two, we were putting the resources where they were needed most. And we went through that same process again this year in preparation for the start of this summer next week when we kick it off. And again, the locations remain virtually the same. So the libraries that we're using are the same, with the exception of the overnight one at Burton Bar. They were the same again. So really for us, that data-driven analysis was crucial for all of that operational decision-making here as far as the resources went. We did have some outreach with our partners over at Maricopa County, but again, most of our operations were driven in the downtown core where most of our activity was. But we do share, and we were sharing data with Maricopa County as well as a partner within the network. So that was pretty much where we got most of our information.
Great, thank you. And I see another question in the chat. This one's about wanting to know how you were able to convince people about kind of supporting unsheltered communities. There's a lot of discussion in New Mexico, which really focuses on criminalization rather than providing services.
I'll take this one. So yeah, Phoenix has for years led with the service-driven approach. The mayor and council created the Office of Homeless Solutions to really be that people-centered, but we work very closely with our police department partners. They have direct connection to us. They can offer services to, but it was a full, Michelle displayed all of the partners at the city of Phoenix. Homelessness touches every single city department in the city of Phoenix. And And really, we relied on all of our city partners, from police and fire, Office of Homeless Solutions, to transit and other city employees, to make sure that people knew, got the word out about these heat resources last year. We worked very closely with our communications department as well to make sure we had information at bus stops, QR codes all over the city, so people knew where the resources were. But I saw that one too, and sorry to hear you're stuck in a situation where you've got criminalization of homelessness instead of support and helping connect people to services.
Yeah, thanks, Rachel. And Michelle, I'm hoping you can speak a little bit to the utilization of city buses and how you were able to do that as a researcher. That's something that's continued to be a fascination for me and something I'm hoping to see in New Mexico.
Yeah, I chuckle a little bit because there's mixed reviews, I think, sometimes about the utilization of those buses 2 summers
Oh,
ago.
please.
So
Mhm.
that was in 2023. We still had this area around the Key campus that was anywhere between, I think, 700 to 800 people experiencing homelessness in that area around that shelter in 2023. And so it was just a really big hotspot. And we were noticing that people they weren't leaving to go to the cooling centers, even if we were offering free rides. And we did notice that there was a little bit of a barrier for some people wanting to utilize that shelter that was right there. And so I'm really of the mindset that you want to meet people where they're at, whether it's mentally or physically, right? Like, where are you at today? And how can I help you? And so under the incident management team structure, I mean, again, everything is such a collaborative effort. We pulled in transit, public health is helping, Office of Homeless Solutions, emergency management, like we all had to get together and be like, how do we do this? How can we meet them? And I would like to say, I think something that we took away from this is like, they didn't want to leave their homes. Like, these were their this was their property. These were their things. And they didn't want to go too far from them. And so we really had to bring a cooling opportunity to them. And so we looked at the area and we selected one of the streets where we saw a high population of those experiencing homelessness. And we parked a city bus there. It was an extended one. I think we could fit something like 30 people, maybe 40 people on there. And it was there from 7 to 7. And we saw great numbers. I mean, people utilize it all summer long. We really got some great testimonials from it. We are fortunate enough that that area is no longer populated like that. We had a really great outreach happen in 2023, 2024, and we're able to get people into housing or shelter in other ways. So thankfully, we don't need to do that intervention in that area anymore. And we haven't seen such a big population of those experiencing homelessness pop up again. Rachel, please correct me if I'm wrong. So we really haven't had to utilize that intervention again. And I do think with this 24/7 respite center that we have being so close to where we are seeing those high numbers of those who need assistance, it's been able to replace that. So people are willing to walk that mile and come into the respite center, talk to CBI, talk to Office of Homeless Solutions, and get those services. So it's a great intervention for that summer, but we're happy that we have other things.
And one thing I'll just add to that, thank you, Michelle, great review of that. And that while all of this was going on too, the Office of Homeless Solutions was really focused on creating more housing and creating more indoor shelter capacity in our system. We had a real lack of capacity, especially through the pandemic when we saw our numbers of people experiencing unsheltered homelessness rise. So we're really focusing on those more those indoor locations where people can be year round and work on ending their homelessness as well. So thanks, Michelle.
Great. And then Michelle, can you speak to the water distribution? That's something that keeps coming up in New Mexico. Of course, we're incredibly dry and there's just not water access for people living on this, living outdoors or even just going around the city. So how much water do you give? How do you distribute it? Is there sustainable ways of doing that throughout the year?
Yeah, I feel like so far it's had to be a 3-prong approach. So historically, our office has done regional, and I say regional loosely. So if you are within the city of Phoenix proper boundaries, and you were a part of the heat relief network map, we would provide you with water from May to September. So any cooling center, respite center, hydration station could get water from us. And then of course, we also facilitated water distribution to our own city facilities. So another 62 sites. That primarily was done through a variety of like ARPA funding, some general funding. We are looking, so that 330 I mentioned earlier will replace the ARPA funding. So this is again, something city council and city leadership has said is important. So we will be able to continue doing that, which is great. We have transitioned this year. The county will be taking over that regional distribution, which is going to be really helpful to us, and I think shows that collaboration. And I hope that that means that more people will have access to the water. Last year, though, just within the City of Phoenix efforts, we gave out over 1 million single-use plastic water bottles to over, I think it's something like 120 sites or something like that. We like quadrupled what we had done the year before. And so I think it really just goes to show that it is needed. To your point about sustainability, I don't love giving out single-use plastic water bottles, but I don't think we're in a position yet where we can't do that. We have to have water on hand to help someone in need. We've also found that having that bottle of water is a really great conversation starter. So you might be out doing outreach. Hey, can I give you a cold bottle of water? And now the conversation's open, that door's open to have further conversations. We have tried and piloted, I don't know if I can call it a pilot anymore. We've done it for 3 to 4 years at this point. We have these really amazing aluminum water bottles that we'll give out, and we design them with information. So the one that we give to the Office of Homeless Solutions has a QR code to it, to the Heat Relief Network map. So if you're out and you're talking to people, they can scan the code and find their closest respite center, cooling center. Also has the 211 number on there. So they're like, hey, you can call 211 and get a free ride to the cooling center. So that was our sort of effort to be more sustainable, and another way to be creative about how we're communicating resources that are out there. Unfortunately, those options are a lot more expensive than the single-use plastic water bottle. So that's a little give and take there. And then our third sort of prong version of this is we give out Hydro Flask style water bottles. There has been a huge ask from the community to have these because they want to have like, and they're fairly large, they're 40 some ounces. That way, no matter like how far you may have to walk to get somewhere or ride your bike, you've got plenty of water to get there. And it will keep it cold. That was the big thing. Like we could have done plastics, but the Hydro Flask style will keep your water cold. And we know that that is more beneficial when you're dealing with the heat. So those are sort of the 3 prongs. We will continue to provide single-use plastic water bottles to all of our city facilities that are on the Heat Relief Network map. So that's over 60. We've got general funding. So I'm so excited that we'll be able to continue doing this years moving forward because we do see it being important. And then the addition to this is we will also have heat relief supplies at all of our libraries for the first time this year. So we really saw a lot of people coming into our libraries outside of the extended hour ones asking for things like electrolytes and sunscreen and chapstick. And so we're able to do that this year along with the water distribution.
Wow.
I
Okay.
don't know if that answered the question.
Yeah, I guess a follow-up question is around staffing. I've heard a lot of challenges with staffing, especially if you open up like a center, that the hours are extended, often like just the duration of your heat season is so long. Like how do you maintain staffing in a sustainable way? And I think also, Brian Lee, I'd love to hear your thoughts too on just staffing an incident command for 5 months. I mean, that must be pretty tiring for many people.
Yeah, actually, the way we built this out, we went department by department and we identified those critical partners that we're going to have some sort of either a planning, a logistical, or an operational role, even to include our finance directors to make sure that we had them brought on board from the beginning. And the way we built this out was we identified the directors and the deputies, the folks that we're going to be serving in that capacity, and we just started filling in the boxes with who needed what training in order to perform those functions within the ICS structure. And we provided training, and we've actually gotten a really good response. We've had a lot of people turn out for the training, whether they were part of this program or not. But we continue to conduct, ICS training here within the city of Phoenix year round. And we also rely on our partners with the county and the state of Arizona that provide some of that training as well. So for us, that's a priority, making sure that people are trained. So in doing so, we were able to start pulling people from those departments to be able to commit those resources and be able to start building out that model.
Very, very interesting. And Rachel, please, I'd be curious to hear how you guys are staffing the cooling centers.
Yeah, so I'll talk a little bit about last year and the changes we made for this year, because it is an issue. Last year, I mentioned our libraries just have like a portion of that library open. And so we were able to do sort of like overtime or ask people to fill in all these extra shifts, like current library staff. This year, because we knew we had issues with that last year and shifts that went that got harder and harder to fill the longer the summer went on. We did a huge recruitment for temporary seasonal library staff, part-time staff. So we're looking, our library department hired a lot of like teachers that are looking for extra work in the summer, and ASU students perhaps that needed work over the summer. So we actually already had all of those hiring events, so that this summer, as we open our libraries to full capacity, those people have already been hired and have been trained this summer moving forward. So that was a great enhancement we made this year. And then I'll just say too, from our partner at Community Bridges, who staffed our 24/7 site and our overnight site. Community Bridges is a large organization. That's why we wanted to partner with them on this effort. They have clinics, they have a few shelters in the community, they have a huge outreach presence. So we really wanted an organization that had the capacity to do all that. But it was, I will say it was, and we anticipated it to be an issue this year. And that's why we really also layered City of Phoenix staff from Office of Homeless Solutions at these sites as well, and sort of had a regular cadence of who was going to be there. And at one time, in the hottest month, we were there 7 days a week too. So it was a hard summer, but we thanked our employees greatly and gave them a couple extra days off after the summer ended as well, just to really thank them for their commitment. It was tough work.
Wow, thank you. Okay, I think we have time for one more question. This one is for Daniel Cheatham around the ice water immersion. So in New Mexico, so much of our state is rural. We have very few EMS resources. Often the time it takes to get to the person who's experiencing heat stroke is long beyond that 30-minute window before we start to see real, risks to health and well-being. Are there efforts that you all are doing on training community members in like the taco method, or, distributing these sorts of like bags that you can put someone in and stuff ice inside? And if so, I mean, we would love to learn about those, because we've really recognized this as a gap in our state.
So the city of Phoenix, obviously, everywhere is a little bit different. We're densely populated, but we do have we have automatic aid and things like that with our other entities that are around. They're a little bit more remote. So we have shared this with them. As far as I think the individual cities that are kind of remotely would need to work with, just like we're doing here with all of our partners, to put something in place for them. But as far as the EMS side of things, really it's just doing your best with the cold IV fluids. Having all the EMS resources there, the ice bags, and then it's that pre-planning, with the education piece that we have from here, the cooling centers, it all works together collectively. So it's tough for me to speak to their individual issues being remote. I think just the pre-planning, working collaboratively, and having those things in place ready to go. And then that rapid transport piece, whether, it's by ambulance or whether, it's by air, it's hard to put a cost on a human's life, to land a helicopter. So it's really working through your specific agencies, and Commander Lee and his group has done a really good job of kind of bringing all of our resources together together. So hard for me to kind of speak on the rural aspect, but we do try to prepare them and with what we're doing and give them access to our resources. So we will share things with our partners that have a little bit less funding. Each area is kind of unique. So, but I'm willing to share, you know, what we're doing and a little bit more deeper dive with how we could help them offline.
That would be fantastic. Yeah. Do you train any like community groups on these specific methods for cooling?
We train community groups more on the preventative side of things. And again, there are some training. The fire department doesn't directly do it, but there is some education on, hey, if somebody's having a heat related emergency, what are some of the initial things that you can do there until the fire department or EMS arrives?
Perfect. Great. So I know we're at time. So just to wrap up, thank you all so much. There's like robust conversation about how we can do all this stuff here in New Mexico, which means this has been such a successful presentation. Again, thank you all. Well, I'm sure we'll be in touch to learn more. And if you have any resources you want to share in the chat, feel free to do so. And with that, I believe I turn it over to Christine. Thanks, everyone.
Thank you.